Hi, my name is Rosara Rios. I'm a family nurse practitioner student, and I will be performing a head, eyes, ears, nose, and throat exam. First, I'm going to start with assessing your face. I'm going to assess your facial features for symmetry, the shape of your head, the contour. Then we're going to start with inspecting your scalp. So I'm inspecting for any scaliness, any infestations, any dryness. Then we're going to palpate for any tenderness, any indurations, masses, lesions. Then we're going to move to your eyes, your eyelashes, check for any crusting, your eyebrows, the symmetry, the hair distribution. Then we're going to start with palpating your temporal arteries for any tenderness, any pain. Then I'm going to palpate your frontal sinus. Then I'm going to palpate your maxillary sinuses. Okay, now I'm going to move on to auscultating your temporal arteries. We want to make sure that we don't hear any bruise. Okay. Okay, no bruise hurt. Okay, so now we're going to move on to the eye exam. I'm going to start with inspecting your palpebral conjunctiva. So I'm going to lower your eyelids. I'm checking for the color. It should be pinkish. I'm looking at the sclera, the color of the sclera, which is white. I'm looking for any lesions, any ptosis, any exudate, any inflammation. Okay, so now we're going to move on to testing your extraocular muscles. And we're going to start by doing the peripheral vision test. So you're going to let me know when you see my fingers.
No.
Okay.
No.
Okay.
No.
Okay. Now, next we're going to do the 6 visual fields of gaze. So you're going to look straight into my finger. You're going to follow it with your eyes without moving your head. Okay. Good. The other side. Okay, good. Now we're going to assess for convergence. You're just going to follow my finger. Okay, good. Then we're going to do the cover-uncover test. This will check for accommodation of your eyes. You're going to cover your left eye. And I'm just looking at the other eye, making sure it doesn't do any other movement. This will rule out strabismus. Now we're going to cover the other eye, and we're going to check for your left eye, make sure that it doesn't move to any other side. Okay, so next we're going to do a fundoscopic examination. So I'm going to check your right eye with my right eye, and I'm going to stand at an angle, at a 15-degree angle. First, I'm looking for the light red reflex. Once I find it, I'm going to move forward, and we are going to examine and look for the optic disc, the fundus, and the macula. I was able to visualize the optic disc and the fundus, which is a yellow-orange color. Oh, the retina, which is a yellow-orange color. And your blood vessels, there was no narrowing seen, which is a normal finding. Okay, so next we're going to move on to your ears. We're going to start with inspecting the ears, checking both of them for symmetry. We're going to make sure that there is no exudate in the external canal, any redness, lesions. Then we're going to move forward to palpating. So we're going to palpate for any tenderness. Do you feel any pain? No. We're going to do the ear tug. So I'm just going to pull and make sure that you don't feel any pain or tenderness. That could indicate infection. Okay, so next we're going to do a examination of the ear canal with the otoscope. We are going to inspect the ear. So for adults, we're going to pull the pinna up and back. And then we are going to inspect for any lesions. Then we want to make sure we see the tympanic membrane, which should be pearly gray. we should note for any bulging, any lesions that would be abnormal. Then we're gonna move on to do some tests. First, I'm gonna do the whisper test. So what I'm gonna have you do is cover one ear, your right ear, and I'm gonna whisper a word, and you have to repeat it. Okay?
Okay.
So can you cover your right ear? Just cover it like this. Okay. So I'm gonna whisper baseball.
Baseball.
Okay. Now cover your other.
Apple.
Okay. So next we are going to do the Weber test. This one will check for lateralization of sound equally on both ears. So I'm going to put this in your forehead and you're going to let me know which ear you hear it best. Okay.
Both ears.
Okay. Then we're going to continue with the HEENT test, and this one will check for air conduction and bone conduction. So I'm going to put this in the back of your right ear, and you're going to let me know when you stop hearing it, and then I'm going to put it in the front of your ear, and you're going to let me know when you stop hearing it. Okay?
Okay. No. No.
Okay, so this one, we're testing bone conduction versus air conduction, which in your case you had air conduction greater than bone conduction, which is a normal finding, a 2-to-1. Then we're gonna move on to your nose. So first I'm gonna start with inspecting your nose for the symmetry, checking for any lesions, nasal flaring, which could indicate difficulty breathing. We're checking for any discharge from your nares. Then we are going to use the otoscope to inspect your nasal cavity. So I'm going to have you tilt your head back, and then I'm going to inspect your right nare. And I am just looking at the nasal turbinates, the nasal septum. Your turbinates look pink, dark pink, not inflamed, no polyps found, no lesions, no redness. So then we're gonna move on to your mouth. So first I'm gonna start by inspecting your mouth, your lips for any dryness, any lesions, any masses, any exudate, any inflammation. Then we're gonna move on to inspecting your oral cavity. So I'm gonna have you open your mouth and just say, okay, open your mouth and say ah. Okay, and here we are looking at your tonsils, your uvula, which is at midline, your tongue, your pharynx, the soft palate, the hard palate, which are normal in color. It's pink. There are no lesions. Then I'm going to look at your teeth. Can you clench your teeth? Okay. So we are looking for any bleeding, any in your gums. You can close it. For any lesions. So now I'm going to palpate your oral mucosa. Can you open your mouth? And we're just going to palpate for any indurations, any lesions. Nothing noted. Okay, so then we are going to move down to the neck. First, I'm going to start with inspecting your neck, making sure that the trachea is at midline, that there's no enlargement of the neck. So then I'm going to start with palpating your neck, making sure that it is in position, that it is not deviated, that there's no tenderness or any pain. Then we're gonna continue and move on with assessing your lymph nodes. So first I'm gonna start with palpating with the finger pads of my 3 fingers for the preauricular lymph nodes, for any tenderness, any palpable lymph nodes. Then we're gonna move to in the back of your ear for your post-auricular lymph nodes. We're gonna palpate. Then we're gonna move down to your post-cervical lymph nodes. Then we're gonna move forward to your submandibular lymph nodes, to your tonsillar lymph nodes, then your submandibular lymph nodes, and then your submental lymph nodes. Then we're gonna move down to your anterior cervical lymph nodes, and then down to the supraclavicular lymph nodes, then your infraclavicular lymph nodes, and then last but not least on your occipital lymph nodes. Okay, after that we are going to assess your thyroid gland. So I'm going to stand in back of you, and we're just going to assess until we feel the lobes of the thyroid. We're going to have you swallow. Okay, good. We're checking for any masses, any swelling, tenderness, any lesions. Inspecting for a goiter, which there is none. And well, this completes our head, eyes, ears, nose, and throat exam.